parents are come here to meet Dr. Udani, and Dr. Udani is going to give us some information about autism and its complexity. First thing, Dr. Udani, why is autism so complex?
I think why is difficult to answer, because that's how nature made it. But what I can explain to you is why does autism occur? Because that's always a question on people's minds. It's such an odd disorder. It is not, you are very good at certain things, you're not very good at other things. So what is the reason why this happens? So let's look at how the brain works. The brain works in usually networks. So networks essentially means that certain areas of the brain get connected to other areas of the brain, and when these networks are functioning adequately, a certain function can take place. Okay? For example, the most common network which everybody should know is the language network. In the language network, you hear, from the back of the brain, you understand from the back of the brain, and that information is passed to the front of the brain, and from the front of the brain then you actually speak. So there are different networks. There's networks for walking, there's networks for social behavior, there's networks for speaking, there's networks for reading. So it's a very complicated thing. It's a very complicated thing. Now the second thing is that how do these networks form? So these networks form at particular stages in development. So at birth, for example, your language network is rudimentary, but your visual network is more developed. So the language network becomes more prominent between 1 and 3, because that is the time when language develops in the normal child. So does social network develop, because now we know that we call it social communication. So all communication is essentially social communication, which is the main issue in autism. So the social communication is a problem. There are two types of networks. Let me show you this. So this, what you are seeing in yellow and white, forget the blue and the grey, but look at the yellow and white, and that is what is called the white matter. So the white matter is that part of the brain which connects different parts of the grey matter to other parts. So for example, your grey matter, which is here, which is all grey over here, communicates to the adjacent grey matter. Say from here it communicates to this through this very short network, a not short connection. And then you have the language networks, which have long networks. So you're talking from the back of the brain to the front of the brain. Social networks are back of the brain to the front of the brain. So in other words, the long connections are much more affected in autism, and the short connections are not necessarily affected that much. And that's one of the reasons why autism occurs. Now, I won't skip into that. Now let's look at the social network. The social network is one of the most important, explains the theory of mind. You heard of theory of mind?
Yes.
The theory of mind is when you basically understand people's actions, people's intent. These things are very important. So, and that depends on two things. One is, so what happens when you meet a person? So this is the brain, and this is the back of the brain, this is the front of the brain, and I've circled the areas which are connected in the social network. So the first thing is gaze detection. So when I'm talking to you or you, I'm looking at you. Okay, you are therefore appreciating that I'm talking to you and I'm looking at you. So you then know my intent that I might speak to you. Then you're looking at my face. Have you ever seen me before? All these things happen in microseconds. Face perception. So you know whether you know this person or you don't know this person. That is involved from this area. So gaze detection is from this area. Face perception is from this area. Then there's affect recognition. What is affect? Do I look sad? Do I look happy? Do I look worried? Do I look angry? Expressions, and that is judging emotions and expressions. Then I mentalize. So I read your mind. So I know, okay, this person seems to be coming at me with a little bit of an angry look, and maybe there's going to be an altercation now. So how should I react? Should I fight with him? Should I be defensive? Should I go away? And that becomes a social judgment of how to react. So all these things are interconnected. They happen in microseconds. So for example, if I am approaching somebody crying, he understands that I'm sad and he asks, the way he reacts is, what happened? Have you hurt yourself or whatever? In autism, he sees the person crying, he's not sure what that means. So he reacts in a different way. He might actually start laughing. So which is very odd behavior. So the person thinking, what is wrong with this guy? Why is he doing that? So that is the social network which explains the theory of mind. This is another very nice study which was done many years ago to explain this theory of mind and to understand this what is called social responses. Now, to understand this, you must know what a functional MRI is. So, a functional MRI is, like I told you, certain areas of the brain deal with certain actions. So, for example, if you're moving your hand, the hand area will light up on the MRI. That is called a functional for your understanding. Which area lights up when you see something which makes you afraid? Okay, or whatever. So you show an autistic boy who's Asperger's, now it's not called Asperger's, but still, or mild autism. This is an adult, and this is a normal control. And both of them are shown different faces. The first face is there's no face; it's just some dots and dashes. That doesn't incite a response in either of them. Then you have the neutral face, which is not afraid, not fearful, and if that expression also does not really incite any change in either of them. The remaining two, one is 25% fear, they've called it, so just mildly fearful, and the other one is terrified. And both these, in the normal child, or normal adult, this is adult really, the amygdala, if you remember this area, the affect recognition, that area becomes hot. So it actually gets lighted up, so you can recognize the face. It doesn't happen in the Asperger's. So this is how in life it has been demonstrated that this particular social network is not working in autism. The same thing applies for language network. The same thing applies for some types of memory, what is called working memory. Not regular memory. Regular memory is excellent in autism, I'm sure all of you know that.
Yes.
But working memory means when I'm talking to you, you're putting it down in your working memory. So in that memory which is not yet been saved, so it's in the RAM of the computer. Once you press save, it goes into the hard disk. That also happens in human beings, in the brain. Of course, it doesn't happen immediately. So first time you might hear something, you might not remember it. But if you repeat it 2-3 times, that you remember. And then that gets saved in the cortex, in the brain areas, not in the areas which control working memory. So it's very important to know that these areas are affected in autism because they all have networks. There's one more system which I want to tell you. It's called the mirror neuron system. What is a mirror neuron? When you're doing a goal-directed task, so for example a monkey, these are neurons in the brain which are activated when you see somebody do a particular task. For example a monkey, if he's just moving his hand randomly, these neurons don't start firing. But if he's trying to get a piece of some food, so he's grasping that thing, it's a goal-directed task. And if the other monkey is looking at that, he's also having the same neurons fire. Now what does it tell you? You learn by observation. So all of us learn by observation. How do you learn? Baby who say 1.5 years. How does he learn that when mom puts that light on, I mean, that switch on, the light comes on. So then he goes and does the same thing. So this mirror neuron system in his brain is very important for learning through observation. It's also very important in expressions, in learning expression. Now, if you look at the functional MRI, going back to it, the red areas is the size of the mirror neuron system. So this is the normal person. See how big it is. This is the autism person. See how small. So these are all things which have happened before birth. That is the main thing. You have to understand that. So why these things happen? Of course, the most important thing is why does it happen to my child? So the next step is, I think the next question of yours is,
genes
so 1 minute. So what, genes are clearly, it's not just genes. That's the first thing I wanted. There's a huge amount of genetic input into autism, because to make these networks, you see how complex it is, how complex our brain is. You have neurons, they have to know that they have to connect to another area which is here, third area which is there, all these networks. So all these are certain types of, many thousands of genes are therefore needed to form the proteins which will form the networks and will go to the appropriate place. I mean, God has given us a phenomenon, and that takes a long time to make. It's very complex, 9 months when you are in pregnancy. But you understand that whatever is very complex will also can go wrong. Now these genes, there are many genes, not one gene. Therefore nobody has found one gene in autism.
Right.
There are some very important genes, I think the number is 11, which have been found to be very important in autism. But even they explain about 15-20% of all patients. I mean, they explain they are changed in those. So all the patients with autism don't have all the genes which have been changed. So each gene change, so when a gene gets changed, I mean it's not the gene which all of us have, it's a little mutated as it is called. It causes a change, and that change may be very minimal. So by itself it doesn't do anything. But suppose many genes and then the environment, and that is most important, what is called epigenetics. So how the environment changes your genetics. I am a son of a diabetic parent. That also is genetic. But I don't get diabetes because I diet, I exercise, I keep my weight under control, I don't eat sugary stuff. And my sib is exactly the opposite. He develops diabetes, I don't. So what happens in autism? You are born with this. My father was like this. Parents were little introvertish. They don't talk much. So the genetics is there, even in the older people. And then you have the environment. Very good environment in many ways. But what is lacking nowadays? Interaction. So between 1 and 3 years of age, when your social communication develops, what you need is not TV, mobiles. What you don't need is, what you need is people. And you need people in large numbers. Before there used to be, these are all my theories, by the way. It's not only my theory, but many people believe this. But there's no proof as such. But if you have large families, a lot of interaction, and therefore, in the past it used to be different. I'm not saying it's good or bad, but for example, there used to be somebody at home. Nowadays it's more child care. There may be a ayah by who's watching TV, kid also sits over there, or it's, those kind of things have happened. The change has occurred over the last 20, 30 years. And therefore, all leads to one common thing at the end. Lack of poor interaction. Working parents. I'm not saying that's a bad thing. Don't get me wrong. But it has happened. TV, mobiles, cells, people have become addicts. I mean, there's a study which we are doing in Hinduja hospital. We are finding that children with autism, in fact all developmental disabilities, but autism in particular, are using mobiles as early as 6 months of age. They're looking at the mobiles. Now why do they look? It's possibly that the autism itself because they have more visual abilities. Therefore, they are looking at something they understand. Verbal they don't understand. So whatever is visual they're looking at, it's fine. But we have to develop the social communication, and this will retard that from happening. So coming to your last question, what do? You interact. And you interact at a particular time. It's called the critical periods of development. So in other words, if you have, let's go to the visual system. There are all these experiments in poor animals. Say for example cats. So a kitten is born. The same thing applies to babies also. And one eye is blocked off. So you put something on one eye so you can't see with that eye. The kitten can't see. Or look at the human baby who's got a cataract in one eye, the other eye is fine. So there is no stimulation of any visual impulses going to the brain on that particular side. What happens is the first 1 year, maximum a few years, first 1 year, your eye may get corrected, you may do the surgery for the cataract, but your brain doesn't develop. So even if your eye is okay now, your brain has not developed to see what the eye is seeing. So this is a time period. In vision it is first 1 or 2 years of life, maximum 6 years. In language, critical period is earlier, 1 to 3. That is the time when development occurs. So this is by the time you are 7 and 8, of course, this is not 1 to, this is stop at 3. Goes on till adolescence. But in autism it seems to be a little earlier, but still, there's a lot of time to improve. But you need that interaction. So what, you cannot change your genetics. You're born with it. You can change your environment. You can make sure your kids, you play with your kids, you read to your kids, you sit and take them to the garden, talk to them all the time, use science, give them quality time. Don't put I'm with my kid all day. What are you doing? Well, I'm cooking and there's a TV going on and he's watching. That's no good. That's not interaction. So I think the key thing is interaction.
Since we are talking on that topic, there are a lot of twins which in which there is one child autistic and the other one is normal. And what is the risk factor for the second child?
Yeah, so I'll tell you, if you look at, like I told you, if you look at autistic families, initially the old definition of autism is very strict, and therefore there were few patients diagnosed. Now the definition of autism has become a little broad. So you may have a child who's mild, who has eye contact and who does come to the parents and is not completely aloof and all that, but he still has many features which put the baby into the autistic spectrum disorder, correct? So if you look at that expanded definition of the diagnosis, then up to 15-20% of patients have a history of similar features in the family. And if you look at the recurrence risk in the next baby, that has changed in the sense, in the earlier days it was thought that the risk was about 5% and in boys and maybe a little higher in girls. So if your first child had autism and was a girl, the risk was a little higher as compared to a boy. The reason being that to become autistic, a girl has to have more mutations and therefore there will be more severe. Now, if you look at the expanded case definition, so there's a very nice follow-up study of SIBS, of autistic children. And they were doing videos and all sorts of things, from very early life of the SIBS. And they found that they could fit into the autistic spectrum disorder as early as the autism spectrum disorder could be seen in as many as 15 to 18% of patients.
In the second setting.
The second setting. But that means that there are similarities in the genes. Therefore, there's going to be some recurrence risk. But if you interact and all that, risk is much lower. So the genetics is there, but very often it is modified.
It has been often noticed in autism that there are various comorbidities in children who do not get diagnosed at an early stage. So how prone are these autistic children to such comorbidities? How can they be detected and what should parents do to address them? So will a general pediatrician be able to help them better, or a specialized doctor?
Let's see, what does comorbidities mean? So comorbidities means two diseases or two disorders happening together without an obvious cause and effect. So in an adult, you may have somebody who's diabetic and is having sugar problems as well as blood pressure problems. Very often these go together. For example, so in babies, in children with autism, there are neurological comorbidities, neuropsychiatric comorbidities, and there are other comorbidities. So the other comorbidities are, things which are to do with the gastrointestinal. So you have constipation, bloating, all those features in certain subtypes of autism, not everybody. That is unfortunately a very non-specific symptom. So you really can't diagnose autism because he's got that. It says that you have to look into, if you diagnose a child with autism, then you look at the GI aspects. One of the theories is that there's sensitivity to gluten, there's sensitivity to milk protein, which is probably true because many children of autism do have sensitivity detected. And though there is no absolute proof, gluten-free and casein-free diets would help some of the behaviors. It doesn't mean that you have to, everybody has to go on it. It doesn't mean that if it's not helping you, continue it. But there's no harm done in trying it. Especially if you can demonstrate that there is sensitivity to this protein. There are many tests you can do to find. Then there are neuropsychiatric comorbidities. In the sense, other disorders which affect the brain. That is, for example, the most common one which people are worried about is the ADHD. The ADHD is seen in maybe 3/4 of the children with autism. There's a little difference in the ADHD of autism and the ADHD which you normally see. So let's see what normally ADHD is. You're hyperactive, you're impulsive, inattentive. All these three things are there in many normal children who are called ADHD without autism. But they are friendly, they talk a lot, they have a lot of friends. They don't get along with the friends because they're impulsive and they hit out and all that. But they are very interested in meeting those kids. They want to be in the company. They like to talk a lot. They disturb you. They are very disorganized. Nothing is kept in place. They get up late. The time management is a problem. Mothers complain every morning, I'm pushing this kid to get ready, otherwise he'll be late for school. Have you seen Tare Zameen Par?
Yes.
That was a kid. Beautifully done. Amir Khan got the ADHD phenotype perfect. On the other hand, autism, they are also hyperactive, they also inattentive, they are also impulsive. Exactly the opposite otherwise. Don't like to talk much, don't like friends, like to be alone, repetitive behaviors, and most important, very organized.
Yes.
They want everything perfect. So for a long time, the DSM-3, or the DSM diagnosis and psychiatry, to separate these two disorders. Now they sort of lump them together because symptoms are very similar. But there are key differences. The second most important is anxiety. Because you can be anxious without autism. You can have that continuous worrying, something is going to go wrong, something is going to go wrong. Anxiety in autism is almost always there. And that anxiety leads to irritability, which is then misdiagnosed as hyperactivity. So very often anxiety is a mood, anxious mood or low mood. So anxiety often coexists with periods of being down. And you have these people going crazy, he's not sleeping at night, he's not eating, the periods when he just goes crazy, he's crying all the time, he's not doing what he usually. And the other time he's perfectly fine. Very typical. Mood swings almost always occur in autism. Unfortunately, though, it's, we can do behavior therapy and this and that. If the symptoms are very prominent, you should take medications for a short time at least to stabilize the mood, to stabilize that changes everything. Then sleep disorders. Sleep disorder is very common. They sleep very late, they get up very early. So there's a sleep initiation problem. You can't get to sleep. And there's a sleep cycle problem. So they don't sleep for 8 hours. They sleep after 4 hours, they're getting up and they're walking around the house. So this is part of the autism. Sometimes it is worsened by a mood problem. but it sometimes can be seen without. So sleep disorders are a problem, and that can lead to a lot of secondary changes in the family dynamics. Nobody sleeps, is awake, everybody has to work. There's a lot of, your fault, my fault, that kind of thing goes on. So even this, if you have a significant sleep problem, don't be worried about drugs. Nothing will happen. Use melatonin, using Arcomine, clonidine. Don't worry, your kid won't have severe side effects and nobody's going to go crazy. If you have to use medicines for these challenging problems in autism, please do. That's a message I want to give, because I know our parents are. The more educated you are, the more you think the drugs are going to poison you. Unfortunately. You see, these drugs, they go through a huge amount of testing. The only time, I'm not saying everybody should be used. They should be used only when the challenging behavior will become a problem. You can't deal with it. Use medications for a short time, get rid of the problem, and then see if you can wean him off the medicine.
How short is a short time?
Usually 3 months.
3 months at least.
Usually 3 months, and then you try to wean off. But sometimes, it's a problem, maybe not. The last comorbidity, which is very important, one which is of course seizures. Now, to understand this, where do seizures come from? The grey matter. Where do these genes affect? In the grey and white matter. The primary problem in autism, even though the white matter appears to be a culprit, is not. The primary culprit is the grey matter. So the grey matter, if you look at the grey matter in autism, grey matter is where the epilepsy comes from. So it's not difficult to understand that children with autism will have epilepsy in about 25% of patients. Usually it's mild, it's easily controlled. You can't predict it. You can't say, okay, EEG abnormal, so let's start treatment. No point. Many people do that. EEG is little abnormal, shows some occasional spikes, which happens, by the way, in 7 out of 10 autistics. If you do EEGs long enough, you'll find abnormalities on the EEG in 70%. The longer EEGs you do, the more you'll find. Then you go to the doc, somebody asks you, then, oh my God, start treatment. Absolutely wrong. You start treatment only if he has a seizure. Because out of the 70%, only 1/3, about 25% of the 100. So 7 may say 2 or 3 will have seizures. And many 4 won't. So what are you treating? And how long will you treat?
So the seizure attack, does it get better as they grow up? Or does it
seizures and autism are never a big problem. Usually not, should not say never. In majority of patients, 70%, it's not a major problem. They come late, usually in teenage years, adult life. They are easily controlled with medicines. You may use it for a few years, the medicines, and then you may withdraw if the patient is seizure free and nothing happens. It may happen a few times and never again. So it's not the bad epilepsy, usually. And epilepsy doesn't necessarily cause more damage and all, nothing like that. Unless the epileptic seizures are very long. So if you have something going on more than half an hour and all, it's dangerous. So what we do is, we always, if you have a seizure, besides you give medications and all that to prevent other seizures, you also give these sprays, nasal sprays.
Your recommendation for seizures, take medicines when necessary. Or are there any external factors?
Take medications when necessary and when the seizure occurs. That is the necessity. So if 2 seizures, definite. Usual thing is that if you have a seizure, the second seizure will occur if it is going to occur in the first year. So for 1 year you may have to take precautions, and you may have to keep that spray with you or that if you don't want to use it. The good thing about autism is, very often the medication which we use should be one which improve mood, decrease anxiety. And there are certain medicines which do that, and there are many medicines which do exactly the opposite. And that is key. If you use the wrong medicine, your child will become worse. Guaranteed. So you have to be, somebody who knows the psychiatric side effects of medicine. So some of the medicines actually are good psychiatry. They improve mood, they improve, for example, sodium valproate, lamotrigine. And the ones which worsen are something like, levetiracetam, all this Keppra and Levipil and all that. They actually worsen the mood. So you should not actually use them at all.
There's a lot of information coming on the internet about autism and this comorbidity, all these things. So what would your recommendation be on the authenticity of such information? How will you guide the parents so that they get the right information?
So the main treatment is therapy. And therapy does not, I personally feel all therapies improve the kid, because in therapies you have to interact. So when you use behavior therapy and you use this and everybody, mine is better, fine. Everybody is better, but it is interact with the child. And you force the parents to interact. So what I usually say is that please get a home program from your therapist. Whatever therapy you do, everybody, the experts, I am not the expert on that. If you have a lot of sensory issues, maybe sensory integration. With a lot of behavior issues, you can use behavior therapy, ABA based therapies, applied behavior analysis. If there's a very, otherwise thing with the language issues are much more, the education is much more, then you can use speech and language therapy. So, it depends when you might require change in therapies. So whoever your developmental pediatrician is, they should basically guide you in this. Your pediatrician, your therapist can guide you in this. What exactly do you need? Second thing is you need home-based programs. So you need to know what to do. ABA therapies, and the ABA therapies are all based on how you react to his behavior, to remove that behavior and all that. So you have to know, na? If you don't practice the same thing at home, it's going to make no difference. But basically, I think definitely two things which you can try from the alternative therapies are the vitamin supplements, GFCF diet for a short time. You find there is no change, or he's not taking the fish oil, how can I force it down? Don't give it. Give him flaxseed. Flaxseed has omega fatty acids. Put it in his cereals because that's much less taste-wise. And then you have other things like, chelation, complete rubbish. No proof that works. There's no proof that mercury is high. There's no proof, nothing. That giving them chelation therapy and giving them hyperbaric oxygen therapy and all these things work. But people are trying it. People are trying stem cells also. So, stem cells, to understand, imagine stem cells in India, the way they have done, is you take the stem cells and you put it back from the bone marrow and you put it into the child's brain through the CSF. Now understand that the stem cells have the same genetic faults which your brain has. So what you are doing is nothing. Right now all these things are maybe promise in the future, maybe not. I think right now it looks like maybe not is more than maybe. But don't try it without, and you spend whole amount of money and this and that. So what is easy, what is not toxic, you can try. Whatever you try, don't leave the therapy. And you must do between 20 to 24 hours of therapy per week. That is the recommendation. No therapist can do that for you. Only you can do it. And the other thing I want to say is, the father should be involved. The grandfathers and grandmother should be involved. Unfortunately, in our country, everything is put on the mom's head. That is just not possible, this kind of. They burn out, marriages break up.
Are there any therapies or something that you say you should avoid? Would you advise parents not to do that?
Like all these hyperbaric, for example, hyperbaric oxygen sometimes cause seizures. It can precipitate seizures in a seizure-prone individual. So that's something which you should think about before trying all this. Chelation is, something. Stem cells, I definitely don't think is right now enough evidence to even think of it. There was one study from abroad, but that also was, questionable. So.
And as an experienced doctor, what would be your advice to parents whose child has been recently diagnosed? What is the most vulnerable parents?
Yeah, the most vulnerable, because the first thing in the beginning is, this can't be happening to us. Denial, anger, doc is saying rubbish, different doctors are consulted. Then comes the grief and then comes the what is called acceptance. And when you accept, things become better. And things start. Therapy actually, unfortunately, starts when they accept. So I think it's not all bad. Do it early. If you do it intensively, many of them become very normal.
Basically, important is having 20 to 25 hours of therapy, intensive interaction with the child is best. That works according to you.
That's right. That is the foundation. Everything else is, the foundation is therapy. Therapy means basically you can do whatever therapy. There are therapies which, core thing is social interaction. And that too at the right time. So if you start therapy at 6 and 7, it might be a problem. Because therapy works best in the time when the networks are forming. And usually by 7, 8 years, 9 years, they sort of formed. Then to change them is very difficult. So don't deny. The natural thing is to deny, which is okay for a couple of months.
Thanks, doctor. This information was really very fruitful
And I
and
thought this
helpful.
would be better than a didactic lecture.
Yeah, what you showed and you explained, that was really, really very good. Thank you so much, doctor, for giving us your time.
No, I'm sorry I cannot make it for a conference, but I'm committed somewhere else. But all the best for that.
Thank you.
Thank you, doctor.
Thank you for
your time.
wonderful. I'm so
Yeah.
glad you
Thank you so much.